performing you a bed bath. How are you feeling today? Here is my assistant to providing the bed bath. So my name is Nurse Mary and
Nurse Valencia. And before we start, we will go and perform hand hygiene. So let's wash our hands and be back.
So it is important to maintain proper hand hygiene to prevent the spreading of infections. So you start with wetting the washcloth, also applying soap to it. So you start with the face of the client, where you wash the face. After washing the face, you immediately dry. So after finishing the face, you go to the lower body, which is the chest and the arms. It is important to remove the robe first and leave the robe and the chest, but so you are not exposing the chest of the client. And it's important so that the client doesn't have a decrease of body temperature. So you start from distal to proximal. When doing the arms, you start at the wrist, going upwards and onto the armpits. After finishing the washing of the hand, you must dry immediately, and you go onwards to the next arm. At this point of time, you should also be assessing the client's resistance to the bath. If the patient is able to help you with the bath, or if she can move her arms, or the mobility of their body. So after finishing with both arms, you move into the chest, but also be remembered to be rinsing the washcloth. When doing the washing of the chest, it is important to wash under by the neck, under the breast of the client, and going lower to the abdomen. And after the washing, you start drying. It is also important to dry under the chest. After doing the chest, you cover the patient and you go to the legs. When doing the legs, you only do the washing of from the ankles to the upper thigh, and you dry as well. Be sure you be assessing the skin. If there is any irritation or sores. So after finishing with the legs, you go to the back of the client, and by that you turn the patient to the side, allowing the assistant to hold onto the patient to prevent any falling. So doing foot care, it is the last process of the bed bath. You apply a cover sheet to the bed, and first you put the one foot on the water, in the water. So after the foot care is done, it is important to change the water to proceed to the perineal care. So for the female client, you position the female in a back lying position with the knees flexed and well spread. So you cover the body and the legs with a bath blanket, and you start by washing the inner sides of the leg, bringing the middle portion of the base of the blanket up and upper over the pelvic area. So you start by cleaning the labia majora, then spread the labia to wash the folds between the labia majora and the labia minora. Use separate quarters of washcloth for each stroke and wipe from the pelvis to the rectum. So for the perineal care, you want to note the particular areas of inflammation at the scrotal folds in the males. Wash and dry the perineal genital areas. Wash and dry the penis using firm strokes. The person is uncircumcised, retract the foreskin to expose the gland pulse. It is also important to wash the scrotum
of the client and make the head be free on the air, and then washing it up with the water.
That is optional, right?
Optional.
Yeah. So for the oral care, for the oral care, we use your toothpaste, your toothbrush, and towel to dry off and you make sure to get in the upper teeth, the lower teeth, on the sides, the insides, and brush the tongue, and on the top of your gums are to be brushed as well, and the side, the cheeks inside. Then you could add mouthwash like Listerine, but that also is optional. Listerine, yeah. And then if the patient is unconscious, then you are to put the patient's face to an angle, as to have the water and all the mouthwash to fall back out of the mouth as you go by washing, because you don't want anything to go inside the lungs and what's not.